So today we're going to talk a little bit deeper about transmission of this COVID-19 virus. Well, when we first thought about coronavirus and we tried to figure out how is this virus spread, there were two main reasons or two routes of spread. One, we all kind of know that if somebody sneezes on you, droplets can get on your mouth, your eyes, or your nose. And that was pretty straightforward. People understood that. The other way was through direct contact. If you put your hands on a desk or a doorknob or any kind of surface that someone who was positive had put their hands on, and then you put your hands in your face or rubbed your eye, of course you would then contract the virus. There was a high chance that you could contract the virus. But now there seems to be pretty compelling evidence that there may be a third route of transmission, a third way to contract or spread this virus. And that's through an airborne transmission. In other words, the virus is in the air. And that would be a situation where if a person was in the room long enough who was positive and was talking, those virus particles would be in the air, suspended in the air once that person left the room. No ventilation, no circulation of the air, that the person is coughing or sneezing or breathing out, and you have these particles that are called basically droplet nuclei, aerosol particles, little viruses that are suspended in the air. And so, can we see the virus? Can we see these particles? Can we tell where they are? Well, let's look at that. First of all, the particle size or the diameter of the particles that come out of your mouth when you just normal speaking are about anywhere from 1 micron to 5 microns. And just to give you an idea of what the diameter of a micron is, one hair follicle is 8 diameters. So when you think about a droplet coming out of your mouth being 1 diameter, that's pretty small. I mean, it's kind of inconceivably small. And so when we talk about 6 feet of distance, we're talking about the particles that are coming out of your mouth just during regular talking that are about 5 microns, okay? And still, that's pretty small when you compare it to a hair, the diameter of a hair follicle, that's 8. So we're talking about ones that are coming out of your mouth that are about 5 microns. And those studies showed that the ones that are 5 microns, when they come out, just regular talking, they go about 6 feet. They travel about 6 feet and land on the ground. And that's where that whole 6 feet of distancing came up with. I know probably most people really didn't give it a second thought. You know, the guidelines said 6 feet, and everybody that 6 feet just went around the world basically. So that gives you a little idea of if a person's just talking regularly and they're positive, that the particles that they spew from their mouth will travel, the ones that are about 5 microns, and those would be considered compared to the ones that are 1 micron, will go about 6 feet. However, if the person is laughing, coughing, talking, breathing heavy, talking loudly, breathing heavy, that same particle has been shown to travel up to 12 feet. Okay, up to 12 feet. And so you can see why it's so important that we all wear these masks. Because the mask, we'll talk about that a little bit later, the mask cut down on the distance those particles travel significantly. Now, still haven't given you any more significant evidence about the particles being out there suspended in air. 2 studies were done, and one was through the NIH, the National Institutes of Health. The other was done in a correspondence paper in the New England Journal of Medicine, which is a pretty reputable medical journal. Each of the journals showed that these viral particles can live suspended in air, airborne, for up to 3 hours. With that being said, the evidence is becoming more and more compelling. Now, what we don't know is how much, if you walk into a room where you have these suspended particles, what is the concentration, or how much do you have to take in of these particles to become COVID-19 positive? And so that's the other part of the research that needs to be done at this point. But so far, it sounds like it could be possible that this could be a problem. So we're doing more research is being done in that area. They did a study, and they looked at when someone sneezes, what happens with these particles. So we now know that there's all different small particles that come out when you sneeze or when you talk. So they looked at it, and they wanted to see what would happen when one would sneeze. So if you sneeze, of course, the 5 micron particles drop to the floor, and it's probably going to be, if it's a hard sneeze or a hard cough, it's going to go about 12 feet. But there's another, the ones that are less than 1 micron or less than 5 microns, they go in a moist cloud of, it's almost like a moisture of gas that travels up to 23, 27 feet. Yep, that's right, 23 to 27 feet. That really makes you think about the 6 feet of distancing. If a person doesn't have a mask on and they are coughing or sneezing. It also showed that if there's no ventilation, once that cloud starts to evaporate, the moisture around those particles, the viral particles, because we're talking about a person that's COVID-19 and it has the moisture around those particles, once it evaporates, those particles are suspended right there, 23, 27 feet, and at that point they're called droplet nuclei or aerosols. So it's at that point that these particles are viable, and they're viable for 3 hours. That was shown with the NIH study and also with the New England Journal of Medicine correspondence that I mentioned. So what do we have to do? Okay. How do we, if this in fact is a means of spreading this virus, there's some other little things that we need to be doing. Good ventilation, open windows, okay, because we want to circulate air. If there is somebody that is, and we know that there's people that are asymptomatic that could be spreading the virus, they have no symptoms, they're positive, and they're talking, laughing. And so if you're in a room, you want to make sure that you have good ventilation. You can use a fan, you can open up a window, or you can open up a door. Keep those things in mind, because we're in a situation, we're in a pandemic situation, so all the information that you can gather helps. And so I'm giving you more information that will hopefully prevent and protect you from becoming COVID-19 positive. One last thing, because people are asking about the mask. Does the mask help? Should I wear a mask? When should I wear a mask? If a person coughs, and then again, there was a study that looked at all of this. If a person coughs without a mask, those particles will travel about 12 feet, 12 or more feet. If they have a mask on, like a t-shirt kind of bandana mask, it cuts it down to about 3 feet. So if you have that mask on, the particles are cut down 3 feet. If you have a cotton mask on, cotton handkerchief-like mask, that cuts it down to about 1 foot 3 inches. Okay. A commercial mask that you would buy at CVS or Walmart, the cone mask, cuts it down to 8 inches. The medical blue mask that you see people, and then they have at the stores, cuts it down to 8 inches. The one, it was kind of interesting because there was one mask, the quilted mask that people have, and you can kind of tell the ones that are quilted or made out of quilted material, cut it down the movement of particles out of the mouth by 2.5 inches. In conclusion, and in summary of all of this, make sure that people have a mask on. Assume everybody has this COVID-19, and please encourage, first of all, you wear a mask, and encourage other people to wear the mask. It does work. It does help stop the spread. We also want to continue to wash our hands. We know that contact transmission is there. And now we know that there's this compelling evidence that's mounting that this virus is viable in the air, airborne. And so with that, I will end. If you like, push the button like. And for more information, see the link below.